I am Dr. Kaustubh Durve, Senior Consultant in Orthopaedic Surgery at Apollo Spectra Hospitals. I specialize in knee and shoulder surgery, and I have trained extensively in arthroscopy and joint replacement, including ligament surgeries in the UK. Many patients ask me about ligament injuries and torn ligaments in the knee and how you treat them. Well, first of all, let's understand what ligaments are. Ligaments basically are something like ropes. They hold your joint together. So whenever two bones meet in a joint, you have rope-like structures which hold the joint together and allow it to move. And these are the ligaments. As long as all the ligaments are there, the joint is stable and it moves normally. But if some of the ligaments get damaged, then there are abnormal movements and instability in the joint. These ligaments are typically injured in sports, particularly sports which are very violent like football or rugby, but even other sports like cricket and all can easily cause ligament injuries. In our country, another very common cause of ligament injuries is motorcycle accidents. Two-wheelers are very common here, so two-wheeler accidents are another very big cause of ligament injuries. After ligament injuries, the patient first experiences pain and swelling, and then over time, if the ligament does not heal well, then he will have instability, which means the joint will not feel good, it will not feel stable, and he may not be able to do heavy activities like running and sports and things like that. By and large, you can say that ligament injuries are of two types, or rather, for the sake of treatment, we can say the ligaments are of two types. There are some ligaments which will heal on their own with little bit of rest, ice, compression, so which means we ask the patient to take rest, put ice, apply a compression kind of a crepe bandage or some sort of elastic support, and over time slowly the ligament heals. And then there are some ligaments which do not heal. Typically in the knee there are two ligaments which do not heal, which often require special treatment, and those are the cruciate ligaments, the anterior cruciate ligament and the posterior cruciate ligament. These two ligaments are in the center of the joint. They are very important in keeping the joint together and making it stable. And these ligaments, once they tear, they do not heal on their own and often require surgical intervention. For these ligaments, because they are in the center of the joint, nowadays rather than opening the whole joint and doing the repair from inside, we just do an arthroscopic surgery. Now, arthroscopic surgery is a minimally invasive surgery. It's a keyhole surgery which we do through small incisions. We just make small cuts on the knee. We put a telescope inside which shows us all the picture of the knee on a camera, on a TV screen. So looking at the TV screen, we can see the ligament tear and we can repair the ligament tear through the arthroscopy. The advantage of this is that because there are not many cuts on the knee, the rest of the knee ligaments are not damaged and the patient recovers very fast. So when we talk about ligament injuries, recovery from ligaments, surgery for ligaments, many people are apprehensive about how they will recover, what they can do later, what are the restrictions. As a general rule, ligaments are a little slow to heal. So it's one of the slowest tissues in the body to heal. So it takes time. But once it heals, there is no long-term restriction. So for ligaments who don't need surgery, those patients generally recover somewhere around 3 to 6 months. By 3 to 6 months, the ligament is reasonably strong. And it may take another 6 months or so for the joint to get readjusted to the new healed ligament. And even after surgery, the recovery time is approximately the same. So 3 to 6 months for the new ligament to get embedded and become strong. And after that, another 3 to 6 months for the joint and the muscles to relearn the coordination and get all the activities and the movements back.